Okay, here's what you're waiting for. Let's talk about the 5 most common mistakes people make. Because again, I work with interns and everybody. Number 5, I'm going from 5 to 1 if you didn't figure that out. Not using it. You would be amazed at how many vets say, yeah, I've got a laser, and it's sitting over there in the corner. Everybody knows about the contraindications, but some people don't realize what all the indications are. So let's talk about those for a second. Contraindications, easy, cancer, right? Except when it is indicated, or at least used for palliative reasons. We have a whole lecture on cancer. Tattoos, that's an easy one. Absorbs the heat, can burn really easy, don't do it. Injection sites, have you thought about this one? This is where you inject a substance into an animal, and if you laser over it, we don't know how that's going to affect the metabolism of it, the substance itself, the dog's reaction to it. So for right now, that's a don't want to do that. Everybody remembers, oh, I use laser for dentals, right? It should be all the time. Any surgery to make it heal. Osteoarthritis, everyone remembers that one. But again, I have a whole lecture on neuro. Stroke, do you know there's great research on looking at treating the brain through the skull? Nerve regeneration, we talk about IVDD, FCE, all of that. I call it intraoperative purple. So if you look on your picture, right, that's a bladder and it's purple. But it could be an anastomosis, a foreign object in the intestine, anything that's purple, make pink. You can do it right during the surgery. Then, if you need to, you can do it again later after they're closed. Kidney perfusion. Do you think about, oh, I have this old 18-year-old cat coming in, and it might be something that his kidney function is starting to decrease? Don't wait till he's in failure and has to have sub-Q fluids. We can actually work with those. We know that laser can decrease fibrous tissue, right? So we have more kidney functioning and cause vasodilatation or dilation. So you have more blood going through the kidneys for better cat health or dog health. Bronchitis. Do you know that you can treat the bronchi and the lungs? Cool, cool stuff. Chronic cystitis. Think about all the cats that have been given up, euthanized, because they're not urinating in the litter box. Think about if they have a chronic cystitis and that's their way of saying, Mom, Dad, help me. It hurts. Being able to reunite them, well, can't reunite them, but help the patients that come in with that so that they don't have that problem and they can stay in their home. Degenerative myelopathy, there's new studies out on how laser can help that significantly increase life expectancy. Behavioral, again, treating the brain to help with behavioral issues that before we had drugs if we had drugs. Cellulitis. Get rid of that extra fluid. We could do it. And then, of course, I started with the ones that were most obvious, and then we get to the bottom ones, right? The ones we don't want a picture of. Perianal fistulas. You say, yeah, Laurie. Yeah, just treated one 2 weeks ago, 3 weeks ago. Dog's doing great. Snake bites, amazing results. Anal glands, let's think about this. Would you rather have someone squeezing your butt or making it nice and warm and fuzzy?